Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. We're broadcasting live from the Dolph Simons Family Studio. It is good to be back. Had a great time out in Colorado doing a little fly fishing, socially distanced approach, of course. But now back here in the saddle, and just really happy to be back home. And we have some great guests with us today. But first, Dana, how are we doing?
It's good to see you back.
It's good to be back. Little Hawkeye, I leave town and all of a sudden the numbers go up. What's that about? What did you do here?
You know, I think you just weren't here to
I think
help.
that was it.
That's what it was.
To scream about infection control all the time.
And I don't know if some of this is part of that, 2 to 4 week surge that we saw from the Labor Day or anything like that. But certainly we know that the cases in the Kansas City area are up compared to where they were 3 weeks ago as well. Unfortunately, our hospitalization numbers are up as well. So right now we have 34 patients in the hospital in the acute infection period. 9 of those are in the ICU, and 6 of those ICU patients are on the vent. We still have 3 people on the ventilator who meet that recovery status. Overall, we have 27 other patients in the hospital who are on that recovery status. So that's about 60 patients who otherwise wouldn't be here. And then in Hays, they have 14 patients who are active infection and 1 in that recovery period, so a total of 15 in the hospital there as well.
So everything's a little busier. I was in Hays, as you know, last week, broadcast on a Wednesday. Great team of people out there working hard around this, and among other things. And I know that it's good that they're stable, but that number coming up here, you just got to think that between the schools reopening, sporting events, the holiday, and just looking down and knowing that we've got flu and just common cold and stuff like that, next few months could be a bumpy ride.
It's going to be difficult as far as assessing symptoms, when to get tested, who to test, when to test, all of those types of things. Plus, if it is COVID, again, most people will be okay and they'll be fine. But as we have seen in the numbers, not only here but around the city, the numbers are going up for hospitalizations too, and that's unfortunate. And it's all ages as well.
And today is the first day of October, and we know that just around the horizon is a spooky holiday.
That's right.
And we don't want people to have too much fear about having a lot of fun. You can find a ghost in every corner. I'm just doing good. I'm on a Halloween roll here. But we have a special guest today. We do all understand the appeal of Halloween. And as physicians, perhaps the only thing scarier than a costume is the potential that we have for viral spread, because the virus is probably about the worst demon, the worst gremlin, the worst thing we can see around Halloween. So our special guest today is Spencer Terry from Salt Lake City. Salt Lake City. Spencer is the general manager of the Fear Factory and a board member of the National Haunted Attraction Association. I've got to tell you, when I say something like AHA, I think American Hospital Association, but this would be the American Haunted Attraction Association. So that I didn't know that was out there. That's kind of cool. He has a remarkable story and advice for us on what you should consider before deciding to trick or treat or visit a haunted house. Now, you may think that this is a reach, but folks, this is not a reach. This is no more, or it's no less important than how we have approached when you wanted to go to a football game or to a baseball game or going to a restaurant, because people are going to want to go out and do haunted houses. So when this story first came to us, we said, man, is this really real? Can we really haunted houses? So we sent our infection control team out to patrol this guy and say, tell us about Spencer Terry. Is this guy for real? And I look at his background. The answer was, he's really great. And I love the fact he's got goblins and ghouls sitting behind him on the video. Are any of those people post-COVID? That's what I want to know.
All 3 of them. Yeah, it was a rough time.
That wasn't. Yeah, it could be that way in a few moments. Got to be careful right here. Well, tell us a little bit, Spencer, about what you do and how do you make a haunted house or other type of Halloween attraction safe?
Yeah, good morning. Safety is always going to be a priority for us as an attraction. That's the one thing I think that we've always been about, is people essentially exchange money for fun and safety, and that's certainly very serious. When it came to COVID, it certainly threw us a curveball. I don't think most of us in the industry have planned on. I mean, we're an $8 billion industry, and it gave us a lot to think about. We had to pretty much redesign everything from how we scared to the types of scares. We had to redesign PPE, a whole bunch of just different things that really kind of gave us a chance to almost reinvent ourselves. And it was a moment of either sink or swim. And for those of us that are swimming, we're doing pretty darn well right now.
So, Spencer, tell us about some of the things you did do to make that haunted attraction safe.
So, so for folks, I know we're out of state right now. For folks who don't know, Fear Factory is a pretty decent-sized haunted house. We're a 6-building facility, 2 underground passages. We're about 3/4 of a mile walk through. So it is extensively large. I'm sure you're seeing that in the video that's rolling. But you're going to go all the way up to the 6th floor of our tower. You walk all across the catwalk. And so there's a lot of preparation that was taken. Certainly from the moment people come on our property, we've now put time ticketing into place. We recognized very quickly back in March that things were changing rapidly, not just for us as an attraction, but certainly for our entertainment industry. And in May, we made the decision and said, you know what, we're already planning to open. Let's postpone that a few weeks and let's make sure that we can do it safely and work with our health department, they've been phenomenal to work with here locally, our Salt Lake County Health Department. And we put together a plan that essentially helped us be more safe, still be able to really look at distancing. Physical distancing is obviously something that we understood needed to happen. It was vital to be able to open. And we now have a mandate that's required for our county, which was great. It allows us to be able to say, perfect. Now our staff can not only be masked, which we had planned on anyway, but now customers will be. And it's allowing us to now be able to open now and still be able to have a good time, still be able to have a great holiday. For a lot of folks, Halloween is more than just a holiday. It's kind of for I think some folks, it's a passage. It's a way of how to celebrate being through a year, kind of similar to how New Year's is or how Christmas is for a lot of folks. And we have almost 60,000 people that come to our attraction each year. So we're excited to welcome a lot of them, even though we're going to be reduced capacity because of that physical and social distancing. It's something that we're willing to do this year to make sure that we can still have a great season.
Yeah, that's awesome. Well, applause to you for taking this so seriously. I do want to know, though, that, we do those nasal PCR swabs that kind of hurt. How do you do those on, say, Frankenstein or a ghost? Because I think there could be an occupational hazard if you tried to do that.
Straight through the ear. Yeah, just don't even bother doing it nasal anymore. So
yeah, that makes sense. Like you get more of the brain that way. So, well, Fear Factory has made this national news. So congratulations for doing that. That's awesome. Well, let's first, Jill, turn and see if there are questions for media about how things are going.
Good morning, guys. It's Taylor at Channel 41. I know you're going to talk a lot about Halloween this morning, but the main thing I want to ask and that I want to make sure gets covered is there a safe way to observe Halloween at your home? I know you guys are going to talk about trick-or-treating a lot, but we've seen things about people putting out like long PVC pipes from their door down to the end of the driveway so they can slide candy down to people, that kind of thing. Mm-hmm. Is there a safe way to observe trick-or-treating at your home?
You bet. Well, Dana, the first thing that comes to my mind, and we'll see what Spencer says too, the first thing that comes to my mind is, Halloween trick-or-treating is a very brief encounter.
I know.
If people are wearing masks, especially spooky masks, which I'll try to have on, then I think you could be really safe. I mean, it's such a brief encounter. It's no different than going to the grocery store and checking out or picking up something or walking by somebody on the street. I'm not too concerned about that. Yeah. And I'm not that concerned about the idea that, if you want to try and put the candy into something that slides down and goes to the kid because so they could stay 6 feet away. I guess you could do that if you wanted to. But even without that, it's a pretty brief encounter.
Yeah, I agree. Certainly traditional Halloween trick-or-treating, I think, is on the highest risk on the CDC guidelines. But to your point, I would agree with that. If you can go trick-or-treating or if your children can go with people who are in their bubble, and if it's just 2 or 3 people and you're outside, and for the most part, they can probably separate a little bit while they're walking from house to house. If you do have a mask on, there are probably oxygen slits, in the mouth, but I think that's going to be a huge plastic barrier to a lot of droplets that you're going to be breathing out in general. If you are not a child, if you're an adult, then you should probably have your cloth face mask on. If you're in the house giving out candy, exactly, your interaction is probably going to be half inside and half outside, or it could be mostly outside if you want to move outside anyways. You can have your mask on as well. You can always wear eye protection, and that interaction of giving candy to children is going to be very brief as well.
So Spencer, what are you guys thinking about for this? Because that's going to be something you've had to take on out there with Fear Factory.
Absolutely. I concur with both of you. I think at the end of the day, it's a very brief exchange. I think people are being creative. I mean, Halloween is always kind of pushed people and pushed home haunting, as it's called, and haunted houses and trunk or treats into usually some very creative spaces. And we're certainly seeing that locally here in Salt Lake City, Utah. Obviously, throughout the nation and throughout the world, we're seeing that as part of the Haunted Attraction Association and how people are kind of really trying to be creative. One of the things that, I would even add to what we both of you have said, I'm going to grab one of these masks really quick, is, so, for us, one of the things that we've done, hopefully this isn't going to be too spooky for anyone. So on these masks, so one of the things that we did is we created our own PPE. But one of the other things that we also did is inside of these masks, there's also another cloth barrier. So the idea is that we want to be able to not only have a regular PPE mask that's already approved for all of our actors and our team, but for those actors, they're then able to put this over that as well, and that's going to continue to protect them. And we really tried to make these look as scary as possible. They're out there right now. You can see, that's one of our owners, Rob, that was just on one of our news stations recently. And we were the first in the industry to open back in May, and that allowed us to, unfortunately, have to learn the hard way and very quickly how to create monsters who are scary, who can still be safely protected. And that certainly has helped our success. And I think for parents, family, friends who are interested in trick-or-treating, same, I would say it's worth doing. Obviously, a lot of us have great childhood memories from it. And if you want to take an additional step, put that cloth mask or put that piece over it. You can just super glue it inside of the mask and call it a day, and that's going to give you an extra layer of protection.
Yeah, that sounds like a great plan. I like that. A safe monster. That's pretty cool. I think that's like the best thing right there. So, Taylor, I think you can be safe on Halloween, and I think you can even trick or treat. And if kids are wearing their masks, and to Spencer's point, if they've got a mask and a mask over that, I really think you can be all right. The idea of contact surfacing or contact surfaces like a piece of candy, I'm less afraid of that, Dana. I don't think that's the way you're going to spread a lot of coronavirus. It's really about the aerosol, and it's really about what you breathe in. It's not what you're going to get off a piece of candy.
Yeah, absolutely. And I think more concerning is if you are a house that holds a neighborhood or a friend get together.
Yeah, that's the bigger
which is very common. I mean, I have a friend who's an emergency physician doctor, and we typically go over there with one of my son's friends. That probably will not be happening this year, but I think it's going to be more of the get-togethers inside the house that are going to be more at risk than the actual trick-or-treating.
Yeah, we used to have a great time around that. But I think it's just a different time, and if we can get through this year, because more exciting information about monoclonal antibody therapy and vaccines out there, and I think that those are both pretty.
And who knows, if those masks, if they have 2 or 3 layers of cotton in them, people might be wearing those around on everyday life.
I don't think that'll be part of the house.
New mask fashion, because I think as we're moving forward into this, masks are going to be a part of our lives for the
They will.
future.
I don't think we would do the scary mask thing. I don't think that's going to be part of our dress code.
Some people might. We won't.
We won't. Yeah, that could be bad.
I'll stick with the surgical mask.
Okay.
It's a new accessory.
Yeah, or not.
Absolutely.
All right, Jill, next question. Or any other media questions out there? All right, Jill.
Yeah, so we have a couple of questions for Spencer. Susan wants to know, she said, how do you get the people who go through the haunted houses to socially distance? She said, I have to have my friend, and I'm really close to them because I'm going to be scared.
What do you think, Spencer?
Great question. One of the things that we've specifically done, and this certainly, it is part of an attraction, we have what's called a throughput, which essentially is the number of people waiting in line versus the speed that they're essentially going through and then exiting the haunted house. And we want to make sure that that space is the same between each group. Obviously, there's lots of variables. Some groups go faster than others. And so we have plenty of team. We have over 20 people inside the attraction constantly watching our flow. That's one of the things that I think as an attraction, you've got to spend a little bit of extra money on your labor this year, is to make sure that you do have folks who are in place to watch those kinds of things. One of the things that we're also doing is as we're marketing our event and as people are purchasing their tickets right now, that's allowing us to be able to do time ticketing and be able to physically distance people more. But we're also reminding people, be selective about who is coming with you to the attraction. It should be someone preferably in your household, if not within your bubble. But, you don't want to just reach out to Facebook world and say, hey, I'm going to Fear Factory in Salt Lake City. Who wants to come with me? it really needs to be selective, and you need to still protect yourselves. Just because you're wearing a mask doesn't mean you're invincible. And I think people need to still remember that there is a way to still have fun, but you just still have to take care of yourself and take care of others as well.
Yeah, that is really important.
And I think, to Spencer's point, we don't need to get bogged down in the details. They have done very good in the details, but what they've done is applied the concepts of the pillars of public health, and that's what we have to do moving forward for a lot of different environments, and they have done it sounds like very well. The distancing, the masking, all those types of things, when they've talked about their throughput, all that. So applying these simple concepts that we've been talking about since day one to whatever environment you're in needs to be done, and it will become second nature individually.
The pillars of infection control travel with you no matter where you go, no matter what you do. How many times have we said that on this program? And it does keep you safe. That's the important part. And as we witness right now, coronavirus is real. COVID-19 is bad. And we've got a lot of patients in the hospital right now who've had it. And we've had a lot of patients altogether who have come through. And it still carries a mortality rate around 8% if you get in the hospital. Yeah. That's really high. There are many diseases. When you come in the hospital, they're going to tell you, if you get in the hospital, you have an 8 to 10% chance of dying with that disease, especially an infectious disease.
Absolutely.
That is not something we like. And yet that's the truth. And it can happen no matter how healthy you are or you aren't. And again, and we know it's worse if you get older, if you have other more comorbid conditions. But you can be young and healthy and still have a really bad outcome, and not just death. A lot of injury, a lot of chronic lung disease, insult or heart disease, and you've heard us talk before about that. And you just have to be careful, and you can be safe if you follow the pillars of infection control.
Barbara says, I know a group that is planning a trunk and treat that normally hosts hundreds of people. Is there any way to make that safe?
A trunk and what?
Trunk and treat.
Okay, somebody's going to have to help me.
So they basically park in a parking lot in their cars, and they do it from their trunk, and they just hand out as people walk through in a traditional trick-or-treat line.
God, trunk and treats. Yeah, I'm not up to speed.
I think that it can be safe if, number one, the cars are spaced. But I think you go to Spencer's point before, it's going to be the throughput issue. How many people are coming through? Are they just waiting in line slow? You can usually in a parking lot.
Sounds like farmer's market, right?
Kind of,
it really is a
but you get free
market.
candy.
You get free
which
candy.
Which is better.
Yeah, supposedly. but if you're at the farmer's market, it's the same challenge. I've been down the one downtown a few times and things, and you're like, there's a crowd here, and people really are distancing, and I'm not so sure they're wearing a lot of masks. So it's all about the same story, right? Yeah. It's the same pillars. Spencer, are you guys advising about that kind of thing? I bet have people come in and asking you, how do I do that safely? What do you say to folks?
Yeah, exact same scenario. The pillars are important, and as long as you follow them, there obviously are ways to be able to be more safe in any kind of a venue, whether it's a trunk or treat or if it's, in an attraction our size. I think just looking at all of those things and trying to pre-plan is what's going to be important. I would suggest to Barbara, one of the things that we did, we also decreased our occupancy by 50%. Obviously, that translates to 50% less revenue. It is what it is. We're going to have to do a little give and take, as we look at how we're going to operate in business for the next year or two. But I think same thing. Look at the queue lines that are going to be in that event. Is everyone just one big mass and they're kind of going from mass group to the next trunk to the next trunk to the next trunk? That's not going to work. You've got to be able to figure out how to queue people up, do it in lines, keep people distanced between groups. There are ways to be able to do it safe. They've got to be able to do it. It's part of the reason why we offered our 60-page contingency plan to allow people to try and think of things ahead of time before they actually had their event happen.
Yeah, that is great.
Yeah, I would definitely separate the cars, 8 to 10 feet if you can, and then everybody should be wearing masks. Everybody should be masking.
And you're just going to walk a little more when you're at the event, and that's healthy for you too.
Absolutely.
That's great. All right, Jill.
Margaret said, Spencer says his attractions attract 60,000 people. Have you had any COVID-19 cases traced back to your haunts?
Okay. Have you been haunted by COVID-19?
We are haunted by 13 actual live ghosts. We're a pretty hot paranormal spot. Thank goodness, even when we opened in May, we did so pretty safely. Like I said, we worked really, really hard with our health department. We increased cleaning, we increased mitigation efforts, and made sure that we were as proactive as possible. That led to 0 transfers, no pathogen transfers, no COVID, no nothing for May. And we were very conscious and very careful about how we operated, and we're using that exact same plan now here in the fall. We want people to have fun, but they just need to be able to do so safely. And there's certainly things that we can do as business owners to be able to help be proactive and help mitigate any of those concerns. But thankfully, we've been working really closely with the people and the powers that be to be able to make sure that we have yet to have any concerns. So that's
awesome.
been really nice from us, both customers and staff. So we've been really lucky to be able to at least do what we can.
And Spencer, interestingly, I mean, Salt Lake City is a great town. Love the mountains. Wasatch Range, awesome. But it's a long way to go for me to go to a haunted house in Salt Lake from Kansas City. So talk to me, how widespread is your approach throughout the industry?
Well, Fear Factory had a pretty big impact. I sit on the board of directors. I think there was in the intro for the Haunted Attraction Association. And so we have a pretty broad reach, both nationally and internationally, about 5,000 haunted attractions throughout the globe. Fear Factory specifically, we are known as one of the bigger and one of the certainly bigger and best haunted houses. We're certainly well awarded. And I think for us, there's a lot of great attractions that are out there in the world. For us, being able to open in May kind of really bumped us up a few notches, because we were essentially overnight, we were leading an industry where we realized very quickly that it wasn't just about us and about us opening in May. It was about saving an entire industry. I mean, we're seeing what's happening with theater right now, what's happening with live entertainment, even with zoos or aquariums or even parks. There's so much. Yeah, Disney, Universal. There's so much that's been happening, and people really just didn't know what to do. And so when we opened back in May, we realized very quickly that hundreds of people were asking us about how we're doing it and what we're doing. And so that's why I designed that 60-page plan with our owners. And we kind of put this massive plan together that's on our website on fearfactoryslc.com under our FAQs. And we specifically built that so that other people can use it as kind of a template. And my disclaimer is it's not a one-shot, deal. You've got to be able to take that and filter through your own county regulations, your state regulations. But if you can use that to help be proactive, to build your own plan that's going to allow you to open, great. That's the idea. We want people to be able to open. The economy is a great thing to have, but it needs to be done safely, and we hope that the plan will help folks do that. And so we've now seen thousands of people who have downloaded that. It's amazing. Probably at least every week I get a message from someone saying, hey, thanks for your help. This has been great in the industry. We've been really happy to see what's been happening. And we've now been cleared by our health department to be able to open as well. And we really appreciate that. So we're really happy to be able to make an impact on certainly our haunted house industry, but globally as an entertainment industry as well.
That's great. Joe?
All right, Georgianne says that on Halloween, our neighborhood gets almost 2,000 kids.
Holy cow.
It's a constant parade, which ends at 8 p.m. People come from all over. The neighborhood is planning to cancel this year. Is that necessary?
Wow, here's what I would say to that. That's a lot of bubbles mixing in together, Dana. And I'm going to bet that the infection control, you can't, for what Fear Factory has done, they've put an infection control plan in place to make sure that it is safe, and it sounds like great work. That's tough to do, because that's kind of this unregulated, unmitigated. I mean, people are just going to kind of come in, may or may not be following. You don't have any way of knowing if they're sick. There's not going to be screening. You can't temperature check everybody. I don't know. That just feels a little uncontrolled to me. If you could say to me, I'm going to have 2,000 people coming through, but they're all socially distanced, they'll be in small groups, everybody's got a mask, and you've got it all figured out, that's one thing. That's a big deal for a neighborhood association to take on today, Dana.
Yeah, and I don't know if if it's just the traditional trick-or-treating. Again, hopefully there's no other large group gatherings at those houses. We've talked a little bit about on this show about the just the traditional trick-or-treating, going from house to house. That may be okay depending how big the neighborhood is. I think more that I would really recommend against the gatherings of the neighborhood people and having people at their houses, especially indoors.
Yeah, I think that's the big thing. And I don't know, Spencer, any thoughts that you would have that'd be different? What would you say about that in Salt Lake?
If 2,000 come into a neighborhood for trick-or-treating, that's probably where I would want to trick-or-treat. But I don't know. I'm all about candy. But that said, I don't know that this is the year to do that. I think, we have to play it safe. And, and I come from a home haunting background. my first haunted house, I was 7 years old, and thanks to my dad, who saw my interest and built me a fun coffin to lay in. But this may be that year where, home haunts are going to be more drive-bys than anything. And maybe it's a collective decision to say, let's retain our resources for 2020 and let's buy double the amount of candy in 2021 to reward everyone for not coming this year. Like maybe there is a silver lining somewhere.
Spencer, I bet the dentists in Salt Lake City are like your best friends.
They love me. Yeah,
Getting
mostly because I love candy, but I gave it up a while ago. Man, is it?
Oh, yeah, that's tough. All right.
Marcia says, can you speak to the theory that super spreader events cause the bulk of the spread of the virus? And then she just asked about contact tracing.
Yeah. Super spreaders are interesting concepts, and we know that it's out there, but I don't think it's, it almost sounds like we've given it magical powers, Dana, and I don't think that's really the case. I think what happens is you're in an event where somebody's ill, and because the dynamic of that event, closed room, lots of talking, lots of close contact, that because the event that becomes a super spreader thing, and that's like a single person, and we know that kind of happened early on with Boston. In Boston. And then the flip side, if you look at Sturgis, which can be described, I think, as a super spreader event, then the problem was there's just so many people. It wasn't any one person. It was the event itself and how it was conducted that became the super spreader event. So I think there's super spread individuals. I think there's super spread events.
Yeah, and it's not immediate. We don't know immediately. It takes weeks because we have to get through that second, third level of infection where you trace it back to what was the most important thing about that? There was a large group gathering. Whether it's a joyful wedding in Maine that led to 3 or 7 deaths and prison and nursing home infections, or whether it's the Sturgis thing that, again, led to how many states? I don't know. 10 or 15 states that had infections and deaths as well. So the common thing between those is the group together. And it's something, again, you don't know immediately, but it happens after the contact tracing. And it usually takes those 2 to 3 rounds of infection as it spreads through from maybe 1 or 2 people at the gathering that has it. They spread it to 2 or 3 people. Well, they go off and do their lives, and it spreads that way.
And that's the risk, and that's why the more we can follow, the more we keep each other safe. And you've heard us preach about that before on the program. Our job is not to keep ourselves safe, it's really to keep our community and each other safe. And the way we do that is follows the pillars of infection control. And when you don't, that's when the risk begins to escalate. And it's not that people are bags, they want to go to Sturgis and go hang out. I mean, that's kind of like going to the Fear Factor or a football game or what have you. Those are things we all want to do, and mentally it's pretty healthy to do things like that. I don't think we want to contest that point. But at some level, what sacrifices do you make in the short term to make sure that your buddies and your friends are all there for you in the long term? And it's not just your friends, it's the friends of people you don't even know. And I think, and then the way the virus does work, it's that 3rd, 4th, 5th generation spread beyond the original person. And that's where we're challenged. And just a word about remembering that we're going to be really challenged in the next few months. As the flu and the cold season arrives, a lot of us are going to be sick. And we're all going to be wondering, do I have COVID? And the thing we're going to have to do is follow the pillars of infection control. First of all, wearing a mask and washing your hands are going to help you against the regular stuff. And then if we can make sure that if we're sick, we stay home, that's going to be a big game changer as well. And for those of us that are wired that we always have to come to work, you always got to do this, you always got to do that, that's a challenge, but we've got to keep each other safe. I see Spencer shaking his head yes. Is there anything you wanted to throw in with that?
You're the professionals when it certainly comes to medical world. If there's one thing I've learned is that sometimes the world, be it whatever you believe in, sometimes forces us to slow down. And that certainly is the case now. How do we make sure that we're taking care of ourselves? But also the broader question is, how do we take care of our community? Whether we love them or not, how are we taking care of each other?
Yeah, I think that's right. And, even as the weather turns colder, you can still go out inside and do things. I think there's a little concern about what happens when we all come inside because we're cold. And one of the things I've learned over the years, whether it was because I was going fishing in January or I was going out skiing or just taking a walk or working out, you know what? Bundle up, let's go. I went to the Chiefs game when it was like 10 degrees and snowing. All right, let's go. That was a big win. Any thoughts you have on all that?
Yeah, absolutely. And it's really going to be still pretty comfortable until maybe January, February. So we are still able to do things outdoors here. But certainly, we're always encouraging get out and walk and doing all those things, get out as much as possible.
Yeah, let's do that.
Okay, Melanie says, can you help her understand the different interpretations on the different sites of whether cases are rising or falling? She checked the Kansas City Star, and then she checked the MARC, Mid-America Regional Council site on the same day. One was saying it was going up, the other was saying it was going down.
Yeah, a lot of it, Dana, I think has to do with whether or not, what set of data are you looking at? Is it a rolling 7-day average, a 3-day average? And are you looking at newly diagnosed cases? You're looking at hospitalizations. You got to really drill down to figure out what it is they're describing and what period of time they're describing to understand where cases are moving. What we can say is cases are up. They're up across the United States. You know, the Hopkins has that 7-day rolling average that compares it to a week ago. How are we doing? So you can kind of get a sense of the trends. And that's clearly up every day. Every day I see it. It's up 20%. It's up 11%. It's up 35%. And that shouldn't be a surprise to any of us as schools have reopened, societies reopened, bars have reopened, that we're seeing more spread.
Yeah, and there could just be delays in the test results at whatever site is getting it, whether it's a county or a state site. And then you have that second level of maybe there's a delay in what the data is reported at whatever specific site you're looking at where they're getting their information. So there's always delay in reporting, things of that nature. But maybe pick 1 or 2 good sites that you think are reasonable, such as the Johns Hopkins site. New York Times has a very good site. Either of the Missouri or Kansas Health Department sites and the CDC. Pick 1 or 2 good sources, kansascity.com as well. And again, they get their information from the county health department. So a lot of it could be variability due to that. I wouldn't focus on those details, but just kind of understand the trends. And again, what is that 7-day or 14-day rolling average? That's really what's going to be important.
Yeah, I know both the Times and the Post have open access for coronavirus information, so anybody can go there, and it was laid out very nicely. So.
Okay, Vicki and Roland and a couple of other people are asking, is there any evidence that the virus is mutating?
Yeah.
And then one wants to know about is it airborne spread?
Yeah, well, yes, it is airborne, but it's really air droplets that are the spread. Again, the really small particles can do it, but it's much more unusual. It's not measles, not tuberculosis. This is really more droplet size, and we know that because here in the hospital, we have very little spread, or maybe no spread on our COVID wards, and that just testifies to the fact that it's because then surgical masks wouldn't work as well. But they are working, and the proof is that we're not seeing a ton of people getting sick once everybody across the country in hospitals introduced PPE. That was right. Yeah. I think we have to be pretty comfortable with that part of it. Is the virus mutating? There was an article that came out about some data in Detroit, I believe Fort Wayne State, suggesting that when people are coming in, their viral loads are less than they were when they're presenting with COVID-19. I think that's interesting. I wonder if it says either the viruses are different or maybe people are wearing masks, and that mask wearing is helping us not get as much of a viral load when we do get sick.
Yeah, what I can say is right now there is no evidence that there is any clinically different virus than there was in Wuhan, China. There are reports and there are those articles about the amino acid substitution, that D to G, that maybe makes the virus attach more and more infectious. But even in those experiments with the pseudovirus that they did in the lab, they showed that you actually maybe produce more virus. So certainly the Wayne State one, if it's showing that you have less viral load, there are a lot of conflicting things out there. But so far right now, there is no evidence that there is any clinically different virus circulating really than there was in Wuhan. So that's the important thing to remember. Now, we also understand that I think it's been like tens of thousands of mutations have been found in this 30 kilobase genome of this virus. But any one particular isolate will maybe have 10 to 20 differences in their base pairs compared to the original Wuhan strain. But all these viruses, clinically, what they do are really just about all the same from the Wuhan virus. So just because they have substitutions or mutations within the genome doesn't mean it's necessarily a different virus or a different strain, because they all seem to do the same thing. All of these isolates are really not different from each other. So that's the important thing to remember. And we know mutations happen. This is an RNA virus. Mutations happen a lot in RNA viruses. So that is not unusual. But as we move further into this, we will certainly look. We do understand that even with SARS and even with Ebola, there was one more dominant form that seemed to occur. There maybe seems to have that dominant form now, but that really is based on an amino acid substitution rather than specific mutations or differences within the genome. And even with that substitution, we understand that there are a couple other mutations in the genome that usually accompany that as well. So, but to answer your question, we don't really have a lot of evidence that there's any clinically distinct or different strain than there was from the original Wuhan strain.
Yeah, I think when we think about mutation, it makes it sound like it's a big change.
Yeah.
The reality is it's more like drift. And what you hope is over time that it'll drift away from that spike protein that's causing us all the trouble. But so far, not so much. All right, time for one more question.
Well, can we?
Two.
Okay. Vicki wants to know, she read a study in Vanderbilt that said that antibodies only last for 60 days, and she wants to know your thought on how that's going to implicate, what the implications are for a vaccine.
Yeah, there is some data out that about how long it lasts and whether it's 2 months, 3 months, 6 months. But vaccines work a little differently than that.
Yeah, I mean, in general, we've seen different reports of antibody durability. So I think in the Iceland study, but again, that is a very distinct population from the rest of the world. Let's be clear on that. I think they had antibodies that they could see at least 4 months out. So I think we do see different reports about varying amounts of antibodies at certain time period. I think that will have to do with what your assay is using, but also understand that we are looking at not only the antibodies themselves, but the cells that create the antibodies. So are those cells, those B cells, are they short-lived as well? Are those memory B cells short-lived as well? And in addition to the antibodies themselves, we also understand that T cells, they're another immune system cell. The T cells are very important in this process as well. So I think just going off of one study and seeing how long antibodies last is maybe misleading, because we know that different studies have shown that even shorter than 60 days, but we've also shown other studies that have shown longer than 60 days as well.
Yeah, and I think the flip side of that is even if you've been out of 90 days, those memory, your body does have a certain elasticity to its memory on and you'll respond theoretically at least more rapidly than you would if you were seeing an infection for the first time. Yeah, and some of that may also be due to how severe of illness did you have. Did you have mild or no symptoms at all, or did you have severe illness? There is some data to suggest that if you had more severe illness, you have higher antibody titers for longer as well.
All right. Final question. Dad wants to know if you're going to let your kids or grandkids trick or treat.
Okay, let's first turn to Spencer. Spencer, what are you going to do?
You know what? I have a 3.5-year-old. This is her first year that she can actually really remember trick or treating. We're still going trick or treating. We will be open. Fear Factory will be open here in Salt Lake City. I usually take an hour off just before we open the show and take her around trick or treating. We're doing it. We're going to do it safely. And we certainly take COVID very serious. But we also take creating memories and making sure that people have a great foundation for life just as serious. So, yes.
Yeah. What do you think, Cock? You've got young kids.
Yeah, I will. I certainly continue on a daily basis to gently reinforce within my kids about try and stay apart from your friends a little bit. Try to be 6 feet or 8 feet apart, especially if you're outdoors. It's a lot easier. But especially if you're indoors, if you can, because that's more important. So I also encourage mask wearing, and they are very good about wearing their masks. The culture for young kids and adolescents is actually really good for wearing masks. It's a lot better than some adults in some cases. So I think that's good. I think they have really adapted to this new mask culture very well. What's more difficult, I think, for them is the social distancing, the physical distancing, just because of their age. So, I just gently encourage that on a daily basis. But I think overall, yes, I will definitely let them go trick-or-treating. But I won't necessarily let them go to houses to hang out for an hour or two and be indoors in that large group setting. I think that's a little bit too dangerous. Spencer, I want to thank you for being part of our program today. This has been great.
I'm sad to see some of those COVID recovered patients in the background. I know clearly they've struggled a little bit, but it's good that they were able to come to the show, come to the program this morning as well. And love the work you've done. If I was in Salt Lake, I'd come visit the Fear Factory, and I feel safe doing it.
Welcome anytime.
So thank you.
Yeah.
Thank you.
And thanks to you all and your team as well. Like, I think taking this seriously, the pillars that you put together, I think are really great. I have a medical professional in my house who's a PharmD, and we understand the seriousness of COVID, and so I appreciate what you all are doing and getting that out there as well. So,
thank you.
Yeah, so thank you.
It's also fun to see somebody who loves what they do, and it's clear you do.
That's
so
right.
Here are some cool masks. I hope Spencer has inspired you to create your own fun Halloween costume, and including a protective mask. I want you to see some of those. Some of your pictures of your mask for Halloween. We're going to share those all month long, and sometime we still got to do the 50 ways to love your mask. Coming up, I got a new one for that. This is pretty cool. You know what a mask helps you do? It helps you show your masculinity.
Oh, yeah.
One of the reasons to love your mask. Okay, we're back to, I worked on that one the whole way out to Colorado and back. So listen, thanks to you guys for being part of our program today. Those are great masks. I love that.
Absolutely.
We are going to be joined tomorrow by David Wild to go through our statistics here in the hospital and how things have been going. And we'll give you we'll give you the data, and we'll do it in an honest and forthright fashion, just as we've always done. As I said to you before, we don't like to flapjack on this show. We're not going to try and yell at each other or talk over each other.
No.
We're just going to tell the truth, and we're going to do it in a calm and reasonable, and compassionate and hopeful manner. Because as you try and battle your way through COVID, one of the things you have to have is hope. And I do think there's a lot of hope out there. You know, we can still go out and have fun. We can still go celebrate Halloween. We can still the Chiefs game Monday night, that was awesome. And, you know, we're just doing it a little differently. And had we always been in this reality, we may have looked at the other reality as the change. But right now, this is where we are. And our goal and our job should be to take the joy that we can find and to enjoy it, because it's still out there. There's still joy out there, even in the time of COVID. So tomorrow we'll be back, and of course questions. We'll be taking some questions on Friday, and we appreciate being a part of your day. Let us know if you have questions, and we'll learn and talk with you soon. Have a great day.